We have been planning for 3 phases for Omicron. This plan sets out the actions we will be taking in testing, contact tracing, case management and isolation, in quarantine, care in the community in response to Omicron in our communities. Phase 1 is where we are now, and what we are doing, and we're doing what we have successfully done with Delta, using our tools from a stamp it out approach. This will all be familiar to you. The tools we have used to stamp out outbreaks in the past can also be used to slow the start of an outbreak, giving more time for people to get boosted. And that's why we are currently taking an intensive approach to contact tracing, including tracing secondary contacts. We are still asking that everyone who is symptomatic be tested at a community testing station or primary health provider. If you are required to isolate, you will receive advice and, if needed, support to do so. At this stage, you will need to isolate for 14 days if you are a case and 10 days if you are a contact. These intensive measures can be sustained while numbers are low. Once Omicron becomes established in the community, we will adjust our approach under Phase 2. In Phase 2, our public health efforts aim to slow the spread of the virus. This means reducing the number of cases to a level our health system can cope with. Importantly, because of vaccination and systems improvements, we are in a much better position than we were 2 years ago. The system will focus more on identifying those who are at a greater risk of severe illness from Omicron, which will be a small percentage of cases. As has been the case since the early days of Covid-19, we need to continue to adapt our public health response to safeguard the health and well-being of New Zealanders, and when Covid-19 changes, we change. Any rapid escalation in case numbers will put pressure on our resources and will require us to shift from identifying all infected individuals to being more targeted to those most at risk and those needed to keep the country going. At this stage, most people who are able to will start to be managed through our digital tools. Support from health and welfare services will be provided as required. Text message notification for positive cases will begin at this stage, with phone support still available for those that need it. Contacts will also be notified by text message. Household contacts will be actively managed, with close contacts requiring a day 5 test. As part of the text notification, individuals will receive a link to an online portal called the Covid-19 Health Hub. This will provide tailored health advice and resources on everything a person needs to know in clear, translatable and accessible formats. The Ministry and GPs are already working to identify those who do not have internet access or capability, so that when they become a positive case, they will automatically be flagged to receive a phone call or outreach service to connect with them. If people cannot access online resources, they can still get support from other channels. Healthline remains a key communication channel in responding to the pandemic and can help you with clinical and non-clinical advice. You can reach them on their dedicated line, 0800 358 5453. These measures will slow the spread of the virus, but they shouldn't disrupt critical services that underpin our well-being, like our food distribution or electricity generation systems. It doesn't make sense to take action on one public health threat only to create another threat to our well-being.